Most Americans understand that there are at least two different types of diabetes, but they have trouble figuring out which type is which because the names that we use for the different types of diabetes are confusing and keep changing. In contrast, French-speaking people have been using the same names for the same types of diabetes since the 1880s. They use the term diabète maigre, or thin diabetes, to refer to the form of diabetes that occurs usually in childhood and to people who are thin to start with. In contrast, French-speaking people use the term diabète gras, which means fat diabetes, for the type of diabetes that occurs in people who are at least a little bit overweight and that goes away if they lose weight. If you have thin diabetes, it means that your pancreas is broken. It means that your pancreas is no longer making enough insulin to keep you alive. It means that you will have to take insulin shots for the rest of your life. On the other hand, if you have fat diabetes, it means that you are a naturally thin person and your body is trying really hard to avoid storing any more of the fat that you've been eating. If you have fat diabetes, it means that your body is willing to sacrifice everything: your eyesight, your kidneys, your feet, even your life, to keep you from getting any fatter. The solution to this problem is to do the opposite of what most diabetics have been told. If you want to conquer your fat diabetes, or even live longer with your thin diabetes, you need to avoid eating too much fat. You need to eat a very low-fat diet and actually eat a lot of carbohydrates, especially starch. This video will explain the difference between water diabetes and sugar diabetes, why there are different types of sugar diabetes, how to cure the most common type of sugar diabetes, how to prevent the most serious type of sugar diabetes, and how to improve the health of people with the incurable forms of diabetes. In ancient Greek, the word diabetes meant siphon. It referred to any disease that made you pee too much. In the Middle Ages, diabetes was diagnosed by tasting the urine. By the 18th century, doctors knew that there were two types of diabetes: water diabetes, which today is called diabetes insipidus, and sugar diabetes, which is called diabetes mellitus. Insipid means no flavor. Water diabetes was called diabetes insipidus because the urine is so dilute that it has no flavor. Sugar diabetes is called diabetes mellitus, which means honey diabetes, because the urine has so much sugar in it, it tastes sweet like honey. Water diabetes, or diabetes insipidus, can result from three different kinds of problem. One is that the person is just drinking too much water because the thirst mechanism in the brain is always on. This problem can result as a side effect of some medications, or it could result from some disease or damage to the brain. Another possible cause of water diabetes is that the brain is not producing antidiuretic hormone, which is the hormone that makes you retain water like a camel. The third kind of problem that can cause water diabetes is that the kidneys are not responding to antidiuretic hormone. The treatment in cases of water diabetes depends on the cause. If the person is simply drinking too much water, you just have to restrict their access to water. If the brain is not producing antidiuretic hormone, you can give the person supplemental antidiuretic hormone. If the kidneys are not responding to antidiuretic hormone, then you have to solve the underlying problem. Diabetes mellitus means that the urine is sweet like honey. The sugar in the urine is glucose, which is also found in grapes. The term diabetes mellitus applies to several different diseases, each of which has its own set of causes and treatments. But they all have one thing in common. If left untreated, they cause high blood glucose, which leads to four classic signs: polyuria, which means that you're peeing too much; polydipsia, which means that you're drinking too much; glycosuria means sugar in the urine; and weight loss. High blood sugar causes the kidney to produce lots of sugary urine. The filtering units in the kidney have blood vessels that go through this very leaky sieve. And while the blood is passing through this section called the glomerulus, then water and salt and sugar and all sorts of good things pass out of the bloodstream and into this tube. As this fluid is then passing through this tube, the kidney works very hard to reabsorb the things that your body actually needs. And then anything that's left over gets passed out in the urine. Normally, the body does not want to pass sugar in the urine because sugar is a source of calories, which are valuable. But the kidneys can absorb only so much sugar. If your blood sugar is so high that the kidneys can't reabsorb all of the sugar that's leaking out through this structure, then you end up passing a lot of sugar in the urine. And all that sugar takes water with it. So as a result, high blood sugar causes you to produce lots of sugary urine. The diagnosis of diabetes mellitus is based on blood tests. If you have a fasting blood sugar level of 126 milligrams per deciliter, then you qualify for a diagnosis of diabetes. Fasting means that you haven't eaten for a long time, such as 10 hours or so. If you take a blood sample at any random time, the blood sugar has to be at least 200 milligrams per deciliter for you to qualify for a diagnosis of diabetes mellitus. So a blood sugar that is at least 200 milligrams per deciliter at any time or during a glucose tolerance test will qualify you for a diagnosis of diabetes mellitus. The other criterion for diagnosing diabetes is a test of the hemoglobin that's in the red blood cells. This HbA1c test is an indicator of how bad your blood sugar problem has been over the past 2 or 3 months. So if the blood sugar was high while a red blood cell was forming, then a lot of the hemoglobin in that red blood cell will have glucose attached to it. In other words, it'll be glycated. So if more than 6% of your hemoglobin in your red blood cells is glycated, then you qualify for a diagnosis of diabetes mellitus. Diabetes mellitus is common in the United States. This pie chart represents the U.S. population. About 29 million Americans have diabetes. Another 86 million people have problems with their blood sugar that is not quite bad enough to qualify as diabetes, but is still reason for concern. Many of these people with diabetes do not know they have it. The reason that so many people do not know they have diabetes is that most cases of diabetes are the relatively mild form called type 2 diabetes, or as the French call it, fat diabetes. Only a minority of diabetes cases are type 1 diabetes, or thin diabetes, which results from failure of the pancreas. Now, most people think that diabetes is mainly a genetic disease, but in reality, only this tiny sliver of diabetes cases represent a truly genetic disease. By the 1880s, it was clear that there are 2 main types of diabetes mellitus. Thin diabetes mainly occurred in children who were thin to start with. They rapidly lost weight, went into a coma, and died regardless of treatment. Fat diabetes, on the other hand, was a milder problem that occurred in overweight adults. They would get better if they ate less and exercised more. Thin diabetes was one of the worst things that could happen to a child. It mainly occurred in childhood, but it can occur at any time. It caused rapid weight loss, and it would rapidly lead to coma and death. Before insulin treatments became available, the only treatment was a starvation diet that would allow the child to starve to death slowly over the course of a year or two, rather than going into a coma and dying within a matter of days or weeks. There were hospital wards filled with children that looked like this. Other names for thin diabetes include pancreatic diabetes, because it was clear by the 1880s that the disease was associated with a problem in the pancreas. Or juvenile diabetes, because the disease usually, but not always, arises in childhood. After the development of insulin therapy, it was called insulin-dependent diabetes because it is always fatal if the patient does not receive insulin therapy. However, people with other forms of diabetes may also receive insulin. And today, most doctors in the United States refer to it as type 1 diabetes. Thin diabetes, or type 1 diabetes, is sometimes called the milk drinker's disease. Type 1 diabetes is rare in societies that do not drink cow's milk. There is a protein in cow's milk that is very similar to a protein on the insulin-producing cells in the pancreas. If that cow's milk protein gets into the bloodstream before it is broken down into individual amino acids, the body will make antibodies that then attack the pancreas. Fat diabetes, type 2 diabetes, occurs in people who are at least a little bit overweight, and it results from the fact that their body is resisting the effects of the insulin that their pancreas is making. Their insulin levels may actually be high. However, their blood sugar tends to be high because their body is resisting the effects of the insulin their pancreas is making. This insulin resistance is actually a way for the body to resist gaining any more weight from a fatty diet. The other names for fat diabetes include adult onset diabetes, because the problem usually starts in adulthood. However, type 2 diabetes is becoming increasingly common in children because of the rise of childhood obesity. Type 2 diabetes has often been called non-insulin dependent diabetes because insulin has relatively a little effect in these cases, but many patients receive insulin nevertheless. The currently accepted medical term is type 2 diabetes. However, I think we should call it fat diabetes because it makes it easier to understand the disease. The diagnosis of thin diabetes used to be based on the clinical course of the disease. It was a severe disease that always led to coma and death. Even today, thin diabetes would lead to coma and death very rapidly if left untreated. However, there are some cases, especially in adults, that start off slowly. This condition, which is called latent autoimmune diabetes of adults, or LADA, results from the slow destruction of the insulin-producing cells in the pancreas, whereas in a typical case of thin diabetes, they die off rapidly. Patients with thin diabetes have little or no insulin in their blood. They also have little or no C-peptide. C-peptide is a sign of insulin production in the body because C-peptide is a protein that is made along with insulin in the pancreas. However, the insulin products that diabetes patients use do not contain C-peptide. Patients with thin diabetes typically have antibodies to their own pancreas, especially in the early phases of the disease. Originally, the diagnosis of fat diabetes was based on the clinical course. If you didn't rapidly go into a coma and died, then you had type 2 diabetes, or you had fat diabetes. Fat diabetes is milder than thin diabetes, but it's still a major cause of death and disability in the United States. Fat diabetes is a major cause of blindness. It is a major cause of heart attack and stroke. It contributes to cancer, and it is a major cause of people to lose their feet. People with fat diabetes typically have normal to high levels of insulin in their bloodstream. They do not have antibodies to their pancreas. And if you were to look at their pancreas at autopsy, it would look perfectly normal, but their liver would probably be full of fat. You can have thin diabetes and fat diabetes at the same time. Thin diabetes results from insulin deficiency. In other words, the pancreas is not producing enough insulin to keep the person alive. And fat diabetes results from insulin resistance. In other words, the body is not responding normally to the insulin that the body is producing. So you can have both insulin deficiency and insulin resistance at the same time. By the 1970s, it was clear that there were some cases of diabetes that did not fit into either the type 1 or the type 2 type of diabetes mellitus. There were some patients who looked like patients with type 1 diabetes in that they were young and thin, but their diabetes was relatively mild, like cases of adult onset diabetes. So they started calling these cases maturity onset diabetes of the young, or MODY. When the blood of these patients was studied, it was found that they had low insulin levels. So the problem is their pancreas is producing enough insulin to keep them alive, but not enough to keep their blood sugar within normal limits. This problem is hereditary. You have to have one copy of a mutant gene in order to get this condition, and at least 10 different mutations have been linked to it. So this autosomal dominant disease is something that you can inherit from one parent who has an obvious case of the disease once you test them. Infantile diabetes looks like thin diabetes, but it happens in babies who are usually under 6 months of age, and it is usually treated just like thin diabetes because these patients are not making enough insulin to keep them alive. Sometimes they get better on their own and sometimes they don't. So infantile diabetes is an autosomal recessive disease, which means that both of your parents have to carry that mutation in order for you to get that disease. To understand any form of diabetes mellitus, you need to understand two hormones that are made in the islets of Langerhans in the pancreas. Now this is the pancreas. It's an organ that's right next to the stomach, and it does two different kinds of things. It secretes some things, some digestive enzymes and so forth, into these ducts that then end up emptying into the first few inches of the small intestine. Those enzymes help you digest your food. So people who have a disease of the exocrine pancreas are not making these digestive enzymes, and they have problems with they have problems with malabsorption because they can't break down their food and absorb it. Examples include people with cystic fibrosis. These patients need to take supplements of these digestive enzymes, these pancreatic enzymes. Now, scattered throughout the pancreas are these tiny blobs of cells that are surrounding blood vessels. They surround these tiny blood vessels, and these cells are endocrine cells. In other words, they produce hormones that are then passed into the bloodstream that then carry messages throughout the body. So the pancreas is an exocrine gland which secretes into a duct into the intestine, and it's an endocrine gland in that it produces hormones that go directly into the bloodstream. The two hormones from the pancreas that are important in diabetes are insulin, which is made by the beta cells, which are depicted here in blue, or dark, medium blue, and glucagon, which is produced by the alpha cells, which are rendered here in kind of a pale blue. Glucagon is the hormone that enables you to survive a fast. Insulin is the hormone that allows you to adjust to a feast. Insulin is the hormone that lets you deal with a meal. Insulin tells the cells throughout your body what to do with the nutrients that are coming into your bloodstream from your meal. Insulin tells your body to burn the sugar that's coming in right away and to save the fat for later. When you eat, your food goes down the esophagus, into the stomach, into the duodenum, and then into the intestines. When your food reaches your intestines start to release hormones called incretins into the bloodstream. The blood then carries the incretins to your pancreas. Once those incretin hormones reach the islets of Langerhans in your pancreas, they start to tell the beta cells to start secreting insulin. The insulin that is produced by the beta cells then tells the alpha cells to stop making glucagon. As sugar from the meal enters the bloodstream, then the high sugar also tells the beta cells to make more insulin, which again suppresses the glucagon. So incretins and blood sugar cause the beta cells to make insulin, which then suppresses glucagon. Insulin tells the liver and the muscle cells to convert glucose into glycogen. These are glucose molecules, and in the liver and in muscle cells, they get strung together into a starch called glycogen. Most of the glucose from a meal will be absorbed by the liver before it enters the general circulation, and a lot of that incoming sugar or incoming glucose will be converted to glycogen right away. That's why blood sugar does not go sky high after a healthy person eats a high carbohydrate meal. Insulin lets the muscle and the heart cells take in glucose to use as fuel. So as long as your blood sugar is high, then your insulin will let your muscle cells and your heart cells use as much sugar as they'd like. Insulin also encourages cells to use amino acids to make new proteins, thus promoting growth. So not only will the cells stop breaking down so many proteins to release the amino acids, they will instead put those amino acids together to make new proteins. There are two insulin-like growth factors that are similar to insulin and that serve as powerful growth-promoting hormones. Insulin tells your fat cells to store fat, and thus it helps you gain weight. Insulin tells your body to store the incoming fat from your meal right away. You won't burn much fat until you've used up or stored most of the incoming sugar. So this is, in general, how insulin helps you deal with a meal. Insulin tells your liver to convert the incoming glucose to glycogen for storage. It lets your heart and muscles use glucose for energy while blood sugar is high. Insulin tells the pancreas to stop making glucagon, and it tells other cells to stop breaking down protein into amino acids. So what happens after you used up or stored all the nutrients from your latest meal? Eventually, you will either burn up or store the nutrients that have just been absorbed from your meal. As your blood sugar levels drop after the sugar is being burned, the pancreas produces less and less insulin. The insulin levels in the bloodstream then decrease as the insulin is taken out of circulation by the liver. Once the insulin levels are low, the heart and the muscles get much less access to glucose, which is thus reserved for the brain. As your blood sugar level drops, your beta cells in the islets of Langerhans stop producing insulin. As the insulin is cleared from your bloodstream by the liver, the insulin levels in the blood also go down. When the insulin levels are low, the alpha cells in the islets of Langerhans start to produce glucagon. Glucagon is the hormone that lets you survive a fast. Glucagon is the fasting hormone. Glucagon tells your liver and fat cells to feed the rest of your body while you are fasting. Glucagon keeps your blood sugar from dropping too low between meals. Insulin overdoses are dangerous because they suppress the release of glucagon. Glucagon has effects all over the body that help you survive a fast. For one thing, it tells the fat cells to break down and release fat to feed the rest of the body. Glucagon also tells liver cells to make new glucose out of glycogen or glycerol, amino acids, etc. That's how your body can make sugar out of protein. That explains why it is that people can have sugar in their blood even though they're eating no carbohydrate at all. If you're making a lot of sugar out of all of these other things, then your liver will start to shift toward a different method of fat metabolism, and it will start making some keto acids out of fat. Your brain can use some keto acids for fuel. Otherwise, brain cells can only use glucose for fuel. So they can use your brain mainly uses glucose, but it can also use some keto acids for fuel. Glucagon also tells other cells to break down protein into amino acids, some of which can then go to the liver and be turned into sugar. In a healthy person, the blood sugar is held up by glucagon between meals when you're fasting. Then, after you eat, the blood sugar starts to go up. Then, as the blood sugar goes up, the insulin that's being released from the pancreas pushes the blood sugar back down. And then you're fasting again, and it's held up by glucagon. So you have these two hormones that are working they're pulling in opposite directions. Glucagon pushes your sugar up, insulin pushes it down. Thin diabetes, type 1 diabetes, is a catastrophe because there is no insulin. So as a result, your pancreas will be producing plenty of glucagon even though your sugar is already high. So here, glucagon's pushing the sugar up, and then you eat something and it goes up higher. More glucagon, more glucagon, more glucagon. The problem in type 1 diabetes is that because there's no insulin in the bloodstream, the liver thinks that you are about to die of low blood sugar, and your liver will work really hard to raise the blood sugar because it has no idea that there's already plenty of sugar in the bloodstream, because it has no way of measuring the sugar. All it sees is the insulin telling it to make more sugar. Before insulin, the only treatment for type 1 diabetes was slow starvation. So the only way that you could keep a child like this from going into a coma and dying was to slowly starve her to death by feeding her a low-calorie, very, very low carbohydrate diet. So this would put the body into a fasting state, and since the lack of insulin is normal during a fast, the body could actually adapt to a fast really well. So if you had no insulin in the system, you could fast really well. You just couldn't handle a meal. Now here's the same girl after insulin became available. So she was her life was saved. I mean, she was snatched from the jaws of death. The doctors who saw these cases described them as near resurrections, and the insulin pulled children out of a coma. Insulin overdose is also dangerous because it prevents glucagon from being released to raise the blood sugar. So here you've got glucagon holding your blood sugar up, and then you have a meal, it's going to push your blood sugar up. If you took too much insulin, it's going to prevent your glucagon from keeping the blood sugar normal. So as a result, you can get dangerously low blood sugar and no glucagon to correct the problem. Fat diabetes, type 2, results from insulin resistance. So as a result, you've got your glucagon and your meal pushing your sugar up, and the insulin, even though you've got more insulin than a normal person, it's not having its normal effect. And as a result, the blood sugar can go pretty high. Probably not, generally not as high as in somebody with uncontrolled type 1, but still more than you want. Now, why do people get insulin resistance? I explain that in detail in thin diabetes, fat diabetes, but here let me just show you something we've learned since the early 1930s. This graph shows the results that Harold Percival Himsworth got from the very same patient. In this graph shows the results of a glucose tolerance test that the patient got from having drunk a dose of glucose in water on an empty stomach after having eaten a high-fat diet for a week. Now notice that this patient's blood sugar shoots way up to 200. This patient is officially diabetic at 200. Okay? Now that very same patient, this diabetic result came from feeding the patient a diet that was 80% fat by calorie. Very high fat diet. This is the kind of ketogenic diet that you hear people talk about. Now, as Hemsworth replaced more and more of the fat in that diet with starch, he got much, much better glucose tolerance. Here, the very same person had much, much better, more stable blood glucose levels after a glucose tolerance test after having eaten a diet that was 80% starch by calorie for a week. So if you eat an Atkins-style diet, look at this, you become diabetic. If you eat a starchy diet, you get normal blood sugar. This graph shows the death rate from diabetes in England and Wales during the first half of the 20th century. On this axis here is the mortality index, which is the way to correct for the changes in the size of the population. So it's deaths per however many people. And you can see in the early part of the 20th century, as society was getting more prosperous, you can see that the rate of death from diabetes is going up. And then the war starts and rationing starts, at which point the death rate from diabetes drops sharply. Now this happened because the diet shifted from being fats and fatty meats and butter and eggs and so forth to starchy foods like potatoes. As the diet started to improve improve in terms of people had more options of what to eat, so they started eating more rich fatty foods after the war, the death rate from diabetes started to go up again. And it went down again during this slump, this period of economic depression, things started to improve economically again, death rate went up. Again, slump, it leveled off. And after the slump was ended, it goes up and up more, up until the beginning of World War II, at which point the rationing causes sharp declines in death rate from diabetes. Now the interesting thing here, look at this, is the introduction of insulin. Notice that the introduction of insulin seems to have made no difference in the death rate from diabetes. That's because insulin was saving the lives of a tiny percentage of the diabetic population, which was the people within diabetes or type 1 diabetes. It had virtually no effect on the death rate from type 2 diabetes, which accounted for most of the deaths. So you can see that diabetes, which is a disease of affluence, the death rate's going up as people have more money. It goes down when people are when their food choices are limited. It goes up as they get more money, and it goes down as their food choices are limited. In this graph, we tease out the data from World War II in more detail. So you can see here, this is the mortality rate. See, mortality, death rate from diabetes going down, 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 as the fat consumption went down, down, down. So you can see these two things went down in parallel. The less fat means fewer deaths. Meanwhile, as people are shifting from eating meats and cheeses and eggs and fish and so forth to eating potatoes, what happens? Their carbohydrate intake is going up. And also their protein intake is actually stayed high, because actually there's a lot of protein in potatoes. People don't respect that, but there is. So their carbohydrate intake is going up, and their fat intake is going down, and their mortality rate is going down. So all of this advice that diabetics are being given, that they should eat less carbs and more fat, is exactly the opposite of what they should be doing. If they want to save their lives, they need to eat more carbs and a lot less fat. The evidence from many different kinds of studies, including the population studies, such as the studies of the death rates from diabetes in Britain during the first half of the 20th century, as well as the studies of what happened during Denmark's food rationing during World War I, and many other different kinds of studies of populations, as well as clinical studies of individual diabetics and so forth, have all pointed in the same direction, which is that diabetics need to eat carbohydrates. They need to eat a high carbohydrate diet. And the best diet for people with diabetes has a heavy emphasis on starchy foods such as whole grains and starchy vegetables. This includes things like brown rice or even white rice if you like it, corn, potatoes, winter squash, cassava. These whole grains and starchy vegetables should provide the bulk of your calories. The diet also includes other kinds of fruits and vegetables. It also includes legumes such as beans and peas, but it excludes any sort of animal source foods. That means no milk, no meat, no fish, no eggs, and it also excludes oils. No shortenings, no oils, no butter, not even olive oil, not even these supposedly magical fat supplements that everybody's trying to sell you nowadays. The low-fat, 10% fat by calorie, high carbohydrate, mainly starch vegan diet has side benefits as opposed to side effects. It promotes weight loss, it cleans out your arteries, and it helps to prevent heart attack and stroke. It also helps to prevent cancers and autoimmune disease. It will also help you save money on food and on medicine. It helps you save money on food because the diet is based heavily on cheap starchy foods like potatoes and bread and rice and so forth. And it will also help you save money on medicine because a great many of the prescription drugs that people are using nowadays are really trying to counteract the effects of the fatty animal food diets that we're eating. So if you eat this kind of low-fat, high-carbohydrate vegan diet, the whole family will benefit. On a low-fat, high-carbohydrate, starchy vegan diet, people with fat diabetes will become undiabetic. People with thin diabetes will need to reduce their dose of insulin. People can stop taking many of their medications for blood pressure, cholesterol, and so on. But the thing is, you have to talk to your doctor. You have to talk to whoever prescribed those medications before you make that change in diet, because otherwise you can end up with serious problems with low blood pressure or low blood sugar as a result of a change to a healthy diet. I explain all these things in more detail and give you a lot more information in my book, Thin Diabetes, Fat Diabetes, which is available at Amazon.com. Thank you for your attention.